name is Lois Stefaniak, and I'm a 1970 grad from the School of Nursing and recently celebrated my 55th year reunion. In training, we lived together in residence, connected at an impressionable time in our lives, and most of us spent many of our careers at the ALEC. This became our hospital. I am proud of my 43 years at the Royal ALEC. When Joanna Poveshin was our Chief Operating Officer, we would often hear her say, "We bleed ALEC blood." I don't think there could be a more true statement. My role as Senior Operating Officer Redevelopment is a highlight of my career. In June of 2000, the Royal ALEC began a project to build a new bed tower. My position was to provide leadership, bringing physicians and staff together with architects and engineers. I was a conduit ensuring clinical needs were incorporated into physical spaces. The board were great advocates, focusing on enhancing the environment for our patients and families with technology and comfort at the forefront. It was a pleasure to work with the foundation staff and board members to bring this to fruition. Dear to my heart, our first grandchild was born at the Lewis Hole Hospital for Women in 2011. My family, as well as many other families, have and continue to benefit from their vision of the foundation and their subsequent enhancements. I feel honored and privileged to be able to say I am part of the 125-year history of the Royal Alexandra Hospital.
Hello, my name is Bill Anderson, and I'm a recently retired board member, having served my 6-year term last June, and it's been such an honor to be on the board. Prior to that, I was a founding member of MIC Medical Imaging here in Edmonton, and I was the Provincial Medical Director for Diagnostic Imaging for Alberta Health Services. My relationship with the Royal ALEC goes way back to even before I was born. My grandfather, Dr. Andrew Franklin Anderson, was an internist who started work at the Royal ALEC around 1914. He subsequently became the medical superintendent for the majority of the 1920s to 1940s. Anderson Hall is his namesake, the building Anderson Hall. My father, Walter Sterling Anderson, was a surgeon here at the Royal ALEC, starting practice just after the war and retiring in 1980. During the majority of that time, he was the chair of the Department of Surgery for the Royal ALEC. It was a privilege for me to be a kid walking in the halls of the Royal ALEC alongside Big Walt while he was doing his ward rounds on Sundays. I subsequently became the medical director for Capital Health, Diagnostic Imaging, and interestingly enough, full circle, my office was located at the Royal ALEC. More recently, I've had the privilege of serving on the board of the foundation and been able to see firsthand the great work that the foundation does. The staff is absolutely fantastic, and it's been an honor and privilege to work with the other board members who are incredible representatives of the city and for the hospital. A major project that I had the privilege of working on throughout its process was the acquisition and siting of the PET-CT. Certainly, it was a difficult and challenging project with a huge capital budget need and many, many, many siting issues, but it is now up and running and serving our patients well throughout northern Alberta and bringing biological molecular imaging to patients and certainly giving us more of an insight into the future of personalized medicine.
Good evening. My name is Dr. David Mador, and I was a staff urologist at the Royal Alex for over 30 years. I'd like to talk about the Royal Alex as a teaching hospital for just a moment. As we all know, the Royal Alex is a very busy place with thousands of patients. In addition, the staff at the Royal Alex love to teach, and that combination in my mind is unbeatable. Back in the early 1980s, minimally invasive surgery for kidney stones was in its infancy, and Dr. Bill Ritchie, Dr. David Reish, and myself went down to the United States to learn some of these new techniques. Within 6 months of starting our program at the Royal Alex, we started to get inquiries from urologists across the prairies to come and observe. With the support of the Departments of Surgery, Department of Radiology, and the hospital, we decided to put on a one-day seminar symposium. And this consisted of didactic lectures that we put together, demonstrations in the radiology suite, and demonstrations in the operating room. And we got attendance for over 50% of the urologists across the prairie provinces for that day. And it wouldn't have been possible without the special, fantastic support of the folks in the operating room and the folks in the radiology department. And to me, 40 years later, it just exemplifies the can-do spirit of the Royal Alex and its dedication to teaching, and remains one of my fondest memories. Thank you.
Hi, my name is Judith Hockney, and I had the distinct privilege of being the Senior Operating Officer for the Royal Alexandra Hospital for over 6.5 years. During that time, we developed what we called the Alexandra Way. And this was to augment our culture of care and caregiving, not only for patients, but for the hospital in itself. And that's everyone who is in the hospital, staff, physicians, everyone. I recognized that during the pandemic, the COVID pandemic, the tireless work of physicians, nurses, staff came to work tirelessly every day, worked long hours for the better caregiving of the patient that was in their beds. I saw ORs turned into ICUs. I saw hallways used as patient rooms. We'd walk around the Alex during the pandemic and every day looked at our staff who were tired but still smiling, who worked with families and family members to get them through the hardest time of their life when their loved ones were there sick. Some were sick with COVID, others were sick. We still had to give care to everything else other than COVID as well. So thank you. The Alexandra Way is alive and well, always putting the patient at the center of every decision you make is important, especially in the lives of family and in the patient experience. So my hat's off to all the staff, physicians, everyone who works at the Royal Alexandra Hospital. Thank you.
Hello, I'm Andrew Otway. My journey with the Royal Alex started back in 1965 when I was born at the hospital. I started working with the Hospital Foundation in the mid-90s and retired in 2020 as a CEO. I was thrilled when last year the Vice President Royal Lax asked if I would consider coming back to be part of the Plan Giving Department and the Royal Willow Society. I was also really pleased to be part of working with Carolina Romick on her history of the Royal Alex, the Alex, 125 years. Two themes that I saw in the book were the power of nursing throughout that 125-year period in terms of advancing patient care and innovation and leadership. The second important stream is the power of community to advance the hospital. I think as a foundation, we probably see that most closely in relationship to what our donors have been able to drive in terms of positive change. Olivia Beauty years ago mentioned to me that in many ways, foundations are the way for the general public to be able to communicate their priorities for the healthcare system. And we really did see that throughout the period of my employment, the creation of the Lowesville Hospital for Women, the C.K. Huey Heart Center, and the Eye Institute of Alberta, and the new Orthopedic Surgery Center. These were all really high priorities for the public. We had those legacy transformational gifts like Bill and Mary Jo Robbins, but we also had, gifts that were from small elementary classrooms in the inner city that were supporting our child and adolescent mental health. We saw that through service clubs like the Lions Clubs supporting the Eye Institute. Probably the strongest is with the inner city health program that the board took on over 10 years ago, where the philosophy was much different in terms of that the healthcare ended at the brick walls of the hospital, but rather is connected to the larger social-economic factors in the community. We see that continued on today with things like Bridge Healing and the support from the Burtons and other larger donors and community groups that are stepping forward now into advancing healthcare, linking it up with what the community is saying is really important to them. And I just know for certain that the next 125 years of the Royal Alex is just going to be amazing. So thank you all.